We interrupt local programming for breaking news. State Republicans holding a news conference as we speak, filing a lawsuit against the governor's stay-at-home order. Let's go ahead and watch.
I'm here today with my colleagues and our attorney, Joel Ard. As you know, we filed a lawsuit against the governor today seeking to overturn the emergency proclamation, and I'm going to turn it over to Joel to lay out that legal basis.
Thanks very much. Joel Ard, that's A-R-D. Easier than you do.
No traffic at all.
Yeah, none whatsoever. All right, thanks very much. We filed suit today in federal district court against the governor asking that the proclamation's extension be declared unconstitutional. There's so many problems with it. The most important one is that there's not an emergency in Washington anymore. It's actually really great news, and it's ridiculous that the governor is continuing on the course he's on. What we've discovered over the last weeks and months is that this is a disease that does not affect the youth of the state. No one under 20 has died from it. It doesn't affect really even people under 60 unless they're already really sick. This state's unusual in that it has not been very transparent with data about the course of the disease. We strongly suspect in this state, and we know in other states, that the overwhelming majority of people dying from this infection are people in assisted living facilities, nursing homes, and the like, and people who have serious other illnesses, comorbidities. We know that over 90% of deaths are people over the age of 60, and the governor's not really targeting his order to the people who are most at risk and need assistance in the state. There's randomness in the order that is a constitutional problem. When you tell people that they can go to a casino to entertain themselves and gamble, but they can't gather in a church, there's no health basis for that difference in decision, but it does infringe the First Amendment rights of those people to practice their religion. When you tell people that they can gather in certain businesses and not others, you know, we have a First Amendment right to free assembly. People have constitutional rights to engage in productive labor. And this order is not in any way targeted to the actual science as we know it today of the health risk posed by this virus. Most people in the state are at low or zero risk and can readily avoid infecting the people in the state who are at high risk. And in fact, the Department of Health has had to be dragged kicking and screaming to try to protect those vulnerable populations. So an overbroad, bludgeon approach to a disease that luckily we've managed to constrain, confine, bring under control. We know where the problem is in the state. The problem is not with kids going back to school. The problem is not with people going back to work. The problem is with a unique and vulnerable population that we can all pull together to protect without maintaining this shutdown. No, ma'am, absolutely not. There's so many ways that we can protect the people who are at risk in the state without maintaining a shutdown, and that's the constitutional problem with the order. The state of emergency is not statewide, it's not everywhere in the state, and the governor can't simply insist that there's an emergency when the emergency is passed. And that's distinctly possible. And if you look at the original declaration of emergency, the governor said we were very worried that we'd overwhelm the healthcare system, that so many people would get so sick so fast, we'd run out of hospital beds, we'd run out of ICU space, we'd run out of ventilators. Luckily, that didn't come to pass, but there are no longer any models. The governor doesn't even claim there are models that say if we lifted the shutdown, the healthcare system would be overwhelmed. We sent back the Army Field Hospital. Thank God we were able to do that. We sent 500 ventilators to New York. Thank God we were able to do that. That's actually great news. But the end result of that is there's no longer a threat to the healthcare system. If we lift the shutdown, the governor does not predict that the healthcare system would be overwhelmed. So that emergency has been alleviated. That's no longer the state of emergency. And again, his order is no longer targeting something that is an emergency in the state of Washington. He can't claim otherwise.
Scientists are saying that the number will be different.
The scientists say that the number will go up no matter what. That's always been the prediction. That's always been the prediction.
And that's a risk you're willing to take.
Well, ma'am, what would happen if we maintain the shutdown? Will the number go up? Science says yes. What will happen if we lift the shutdown? The number will go up. Science says yes. It happens either way. And we already know where the risk lies. It lies with a certain vulnerable subset of the population that we can protect without bludgeoning the entire state. And so it's not an either or, because the predictions from the outset have always said that the number will go up. What we need to do is protect the people who are most vulnerable, not bludgeon the state into submission, when ultimately either course has the same effect on the disease.
But
So the governor's authority is constrained by the United States Constitution. And while he has emergency powers, they are not unlimited. And when he has exceeded his emergency powers and banned people from going to places of worship and praying, that violates the First Amendment. When he deprives people of their property, their liberty, their right to assemble, it violates the Fifth Amendment and the First Amendment. So his powers are not unlimited. And when an emergency has abated to the extent that he no longer needs to do that to protect the public health, and I think the science is clear on that, his continuing to do that exceeds any constitutional authority he has.
the people modeling this disease at the University of Washington say now that it's going to be worse than they projected just a couple of months ago. By August, the amount of deaths nationwide could be double. So how do you respond to that?
You know, they've put out a lot of models. We're happy to see that we've come in below so many of them. I don't think they have models saying that maintaining a shutdown like this, as opposed to lesser alternatives of protecting the vulnerable populations we've identified, would be any different. It's very clear. They've always said until there's herd immunity or a vaccine, counts will continue to rise. But I don't think any of their models say that we're going to have the explosive infection that would lead to overwhelming the healthcare system if we lifted this. So, of course, their models say counts are going to continue to rise, but I don't believe they say that counts are going to continue to rise, that this is the only way, blocking people from going to church, blocking people from going to work, blocking people from assembling, that's not the only way to constrain that growth.
So what is the way to constrain that growth?
Obviously, we've learned that over the past few weeks, and I don't know if you're going to want to speak to some of that at all, but we've done great work. The Hospital Association stepped up in a huge way to help the nursing homes manage patient intake, manage people bringing in patients, bringing in staff, and controlling the flow of infection through that highly vulnerable population. That's really where the focus has got to be. And again, we're in a state where the Department of Health has simply not disclosed the percentage of deaths that come from people who are in long-term care facilities. If we look at other states, we see that that's very likely 75% or higher. That's a huge problem, and it's one that's we can focus on, we can control, we can constrain, and we can do it without blocking ordinary people from going around, going about their daily lives, doing the things they want to do, attending church, gathering with their friends.
Well, what about the cases of the people who are in their 30s, 40s, 50s who are not in long-term care facilities that are still getting sick?
What sort of comorbidities did they have? He hasn't released it. We know examples in other states where those run north of 95% of cases. We've learned so much about the course and progress of this disease. It generally does not affect young, healthy people in that fatal way. And so, again, having that bludgeon across the state, months after we've finally learned what the course of the disease looks like, there's not a statewide emergency if that's the actual science that's out there. And I think the governor has not disclosed comorbidity data for deaths in Washington. The Department of Health has not disclosed what deaths are coming from long-term care facilities. That's vitally important information that will show what the science really says, which is there's not a statewide emergency anymore. And you can't claim this overwhelming authority to impose on people's civil liberties in the absence of that emergency.
One thing they have said is that young people can spread it to people who are as well, and so
So Dr. Fauci just yesterday spoke to that, and he said, we're trying to start a study on whether or not that's true. There's actually no proof that that's true. It's actually great news. We've learned a lot about how little this affects the young people. Again, no deaths for people under the age of 20 in the state of Washington. No evidence of asymptomatic transmission by young people. In fact, ever increasing evidence that asymptomatic transmission is not possible. The Swiss have concluded that it's simply not possible and that asymptomatic young people pose no risk to anyone. Again, the science is out there and it's different than what we thought at the beginning of March. And almost all the news we have is good news, that there's not an emergency and things are not as bad as we feared. And with that great news in hand, the governor has just continued to drop the hammer on the citizens of the state of Washington.
Glenn, if I could add, too, none of us argued with or disagreed with the governor's original order. There was a state of emergency, and every one of us supported that. But the continuation of the suspension of civil liberties is what is at issue here. And I just want to turn it over to my colleagues. I know we're on a little bit of a time crunch all the way around. So, Andrew Barkis.
Yeah, thank you. And yes, it's Andrew, A-N-D-R-E-W. Last name is B-A-R-K-I-S. Thank you, Joel, for this and my colleagues for coming together on this. First and foremost, to your point, any death has been a tragedy, and all of those families that were affected, we are not saying that this is not a crisis that does not exist. We agree this has been a crisis of epic proportions for the state of Washington. We also agree that we have taken fantastic steps to mitigate that, and we've shown that there's ways to do this and policies and procedures in place for us to continue if in fact it does come back, if in fact it does, in the fall or whatever else. But our concern is right now is that we're seeing this on a county by county area, that it has diminished. Thurston County has had 100 cases, 1 death. Businesses and families are being affected by this. The catastrophe that's happening to our economy, the fact that our budget in the state is going to be so severely
And you were just watching a press conference happening in Tacoma right now. State Republicans filing a lawsuit in federal court claiming the governor's extension of his stay-at-home order is unconstitutional. They said it's, quote, ridiculous. The governor is continuing on the course he's on. They also went on to say that coronavirus is no longer an emergency in our state and said they'd like measures to protect the vulnerable and allow others to resume normal life. They are still talking there in Tacoma right now, so we just got our signal back. Let's go ahead and continue listening in.
3 weeks, a month, 2 months. We could be under a state of emergency all the way through the remainder of the summer months, and we just don't feel that is appropriate at this point in time.
And you feel that a federal judge should tell the governor to change?
We feel that it is time for a ruling to be made. And our lawsuit is one of several, and there are many, many more to come that we have been hearing about. I'm sure you have heard about, that people, we are bombarded literally with hundreds and hundreds of calls, emails. Every day we're talking to so many people throughout the state who are begging to get back to work. One more day is too long. One more day in areas that have not been affected at all. And so, we look at this right now and we say we need to do something now. And that's why we're here with the courts, to help us to get to that decision, because that has been the big question, right? Does the governor have this authority? Yes. Has it been tested? It's never been tested under these type of circumstances to have a state of emergency go for this extent under this type of thing. It was originally intended, if we all did this thinking we had Cascadia earthquake coming. And we were preparing for that and what it would be if we had a giant earthquake in the state of Washington and all the steps that would be taken. This is something completely different. We've seen what it's done, we've seen what we've done, and we think that there are steps that we can take now. So.
Marcus, your colleagues are just full-time state reps, while also
No.
private businesses.
True.
Cases. I'd like to personally know how you've been impacted. You own hometown property management. I'd like to hear also from the rest of the state representatives how you guys have personally been impacted.
I appreciate that question. First and foremost, we're citizen legislators. We are not a full-time legislature. We're here as citizens. And we have been impacted. All of us work in different various things. I do work for and own a property management company. I have 16 employees. Since the shutdown, of course, we've seen a severe impact in people's ability to pay their rent. people's ability to do the things. So we've had to make drastic changes. I've had to lay off 4 of my employees. We had to cut our staff to hourly. We've shuttered our building. We've been working with a very diminished. We've seen that impact, and all that has a ripple effect. The companies that support my business, we do millions of dollars in ancillary support for businesses that help support our business, and they're all shut down because we can't do that. But the biggest thing is the governor extended the proclamations and started to alter them with more policy. He actually has put in place policy within our industry that is actually affecting our ability to do our job, our ability to carry out our tasks, our fiduciary responsibility, our contractual obligation to manage these homes. I can't serve compliance notices, can't do inspections, I can't increase rents if they were to be increased. We're not increasing rents at this time, but we've had that. And more so severely, the ability to collect debt at the end of this, he's severely impacted our ability to do that. And the ramifications are going to go for a long, long time after this is over. And that is very concerning to us in the business of providing housing. We already have a housing crisis in the state of Washington. I've been working on it, and all of us have been working on that. And this, of course, is only going to have a bigger impact on that. Of course, we've talked about construction and the ability, and we finally are getting back to work very slowly in getting our residential building going, which we feel is only fair based on the fact that public construction has been going ever since day one.
So this is personal.
It is personal, and it's personal because of, I have not. Thank you, Jesus. You know, I praise God every day that I'm healthy. My family's been healthy. People I know have been healthy. And again, for all those who have, I mean, our hearts go out, and we've seen that every day. But every year we see that through whether it's the flu or other things that unfortunately take people's lives in the state of Washington. And so, you know, this is something that is personal, not just on the business, but it's personal when I see my employees maybe not being able to have a job. So there are a lot of other things that do affect us, not just in the business world, but it's all of the other aspects within our community that are being affected so dramatically by the governor's order.
Have any of you personally lost anyone to COVID-19? Any of your family or friends sick right now with COVID-19?
No.
So I know people in my community that have had COVID-19. I don't know if I've had anybody personally die from it yet. You know, I've lost loved ones to other things in my life, and I know how serious that is. My name's Chris Corey. I know you'll want that. C-O-R-R-Y. My family's been impacted, families across all of Washington. I live in eastern Washington, and I have families, friends, neighbors that have talked to me and shared their stories with me across, you know, the Yakima Valley, Klickitat County, Skamania County. Families who have had to go to the food bank for the first time in their lives. And those food banks are struggling to maintain the ability to help feed people through this. And I think that's a problem. And we're not diminishing the loss of life. We need to make that clear. What we're arguing is that we had an emergency arise. We needed to protect our hospitals to make sure they weren't overrun. We needed to get our resources in place, and we've done that rather successfully. But now it's time to focus with a scalpel rather than a sledgehammer on protecting those most vulnerable. And you know, we need to make it clear that if we don't do these things now to get the economy back up now, we won't have the funds to be able to help those people. So we can protect people. We're not arguing to get rid of social distancing and changes at restaurants and those type of things, but we're saying let's let our businesses come to the table and see how they can open up safely so we can get money back in people's pockets, get the economy re-going. I've had businesses all across my district provide to me plans that they've got to help comply. They're coming to me asking to be part of the solution. They're sharing how they're reducing capacity. They've got sanitation measures. And I think that we should laud the businesses for that, and we should trust them to protect not only their workers, but their customers. And if you're an affected population and you need additional help and it's a risk for you to be out, we're not telling you to go out. We don't think you should go out if you're in a more vulnerable state. But that doesn't mean that we shouldn't get those that are healthy and can be out and practice safe social distancing and proper hygiene, that we should prevent them from being out.
But that's not the legal argument.
That is the legal argument.
The legal argument that the governor
Yes, and exceeded his authority. We believe he has. And I don't believe we would be here now if he was following measures that other governors have taken across the country, excuse me. And those are Democrat governors, those are Republican governors. This really isn't a partisan issue. I don't care about the political party of the governor. I care about making sure that my family and friends across the state of Washington have food for their tables and are able to pay their mortgages and their rent. Sure, we talked to some people. Well, we wanted to make sure that we had, not too big of a group. We wanted this to be focused and targeted, and that was why we chose the people we did, and we worked with who we're working with. I mean, we all have, and you'll have the complaint, individual ways we've been impacted. I mean, I have children, I have foster children who have broken braces that we can't get in to fix because the orthodontist is afraid to open up because it's not an emergency enough. And we know that our medical facilities, our dental facilities are going to be missing diagnoses now that could be much more damaging down the road. And so we're saying, let's take steps now. Let's get the economy reopened now. Let's have a better plan so that people can go back to work safely. And we think that can be done. It's not a one-size-fits-all, and it's not a one or the other. I think you can do both safely and protect workers and protect customers and Washingtonians. Yes.
Again, you were watching a press conference happening in Tacoma. State Republicans taking issue with the governor extending his stay-at-home order, claiming it's no longer an emergency situation here in Washington. Again, they're taking issue with that extension, not the original order, so they have just filed a lawsuit. We want to note that the governor is also holding a news conference today. We expect him to address part of what those Republicans just said. We're going to carry that for you live here on King 5 News. It's happening at 3:30.